This is a lady which came to us at the age of 27 years. She was having a complex heart disease in which the outlet of the heart, the main vessel which comes out of the heart, that had got dilated. That's usually approximately 2 centimeter to 3 centimeter diameter. So this lady's vessel was almost 5 centimeter, 5 to 6 centimeter. So it became like a balloon. This vessel which comes out of the heart, which supplies the whole body, it had become like a balloon. So once it becomes like a balloon, there is a chance that it will suddenly rupture. This artery, if it becomes fat, thin and dilated, it suddenly ruptures. If the artery ruptures, the patient dies immediately. Any pressure on the patient, if patient coughs, if the patient has having constipation, if patient goes to the bathroom, this artery can rupture and the patient can die. So this is the condition with which this patient came from an agricultural background. She's a farmer. She's coming from a farmer's family. Husband is a farmer. They do daily work. She also does daily work. So with this problem, they had come to us some time back, and we had diagnosed this condition, and we had done an operation. What is the operation? It is called a Bentall operation. Means that whole of this, what God has given, what the Almighty has given, this artery has to be replaced. It has to be cut, and the heart has to be stopped, and the body has to be cooled sometimes, and there is a valve inside this. This has to be replaced. Usually, this cost of this conduit with which we will be replacing it goes up to 1 lakh, 2 lakh, 3 lakhs and all. It can go up to a high cost. But we made a special conduit with an Indian valve, which we placed inside, and the conduit with which we sutured the valve and this conduit, and we changed the whole of the aorta. So this operation was called the Bentall operation with hemi-arch replacement. We have done some indigenous modifications. It is practiced in India sometimes. This is a rare operation. It has been done in very few centers in the country. Majorly in very big centers, in high volume centers, is the only places with which this operation occurs. Also, that this operation cost is around 8 lakhs to 10 lakhs. It goes up to 8 lakhs to 10 lakhs. But we were able to do this operation free of cost, including the government scheme. Now, this lady has gone back to her house. She recovered from this operation. She has gone back to her village, and somehow she has conceived. After this kind of operation, usually people have to change their lifestyle. They cannot become fully active. Not many of them become fully active. They have to take a lot of precautions. They will be on medications. They will be on lifelong medications. But this lady has conceived. She has conceived, and they called us back and said that we have conceived. We want to continue the pregnancy. So we said, yeah, why not? You can continue the pregnancy, because we had gone through the tests of the heart, and the heart function was all right now, and the valve function was all right, which we have put an artificial valve inside the heart. There is an artificial valve now. It's a metal valve, mechanical valve. So one is she's undergone an operation. She's having an artificial tube, artificial valve. With this lady has come back to us being pregnant, and she wanted to continue the pregnancy, and we also wanted her to continue the pregnancy because she wanted it passionately. She wanted a girl child, which is also special to hear about, that they're coming from a poor background and she wants a girl child. When her due date was there, is when the COVID lockdown has started. So then they were worried how can they come, because this delivery cannot take place in their local district hospital or any other hospital. This delivery has to occur where there is facility with a backup of cardiology, with a heart specialty backup. So this patient wanted to come here, and we coordinated that the patient could come to our place, to Bangalore, in our hospital, in Saptagiri Hospital, wherein we were able to coordinate with the local police, with the ASHA workers, which they really helped the patient to come without any hindrance. So when there was a lockdown, there was full coordination and support from the state government authorities. when there was a medical emergency. So this is like a medical emergency in the time of lockdown, wherein the patient had to come from far, from 200 kilometers, and they came here, and the delivery was done in the next day. The lady got a girl child, and they were very happy about it, and it was very smooth. So what I could see is that when this patient had come before the heart operation, the chances of survival was not very high. She came with a complex problem. This lady has survived, and she survived from a heart problem. She survived after a very complex heart surgery. She's gone back to her village. She has been doing farming. She's coming back with a new life during a time when life is supposed to be ceased. Everything is supposed to be ceased. There's nothing to be done. People telling stay at home, work is suspended.